Hi, I'm Diana Silver, and I'm the Director of Undergraduate Education and Public Health here at the Steinhardt School. And I'm really excited to talk about our new undergraduate program in public health. It's a great program. It gives students the opportunity to get a real grounding in liberal arts, so students actually take 60 credits in liberal arts anywhere they want in the university to meet those requirements. And then they get to concentrate 63 credits, that is more than half their time, studying public health here at NYU. It's a great place to study public health, and I want to tell you a little bit about that curriculum. We have a master's program in public health and a doctoral program in public health, and so our undergraduate curriculum comes out of those roots. And instead of studying things that you might study at the master's level, we want a bigger and broader range of issues that you're going to study. So we're going to ground students in thinking through and debating the issues of public health, both from the perspective of policymakers, from the perspective of neighborhoods and communities, from the perspective of individuals, lawmakers, and people in the nonprofit sector. Your classes are going to focus on things like what kinds of things have communities done to confront the environmental threats that they may encounter, or who should have access to health insurance in this country and what's the best way to deliver it. We'll debate those issues in our classroom because the classes are small. There's plenty of time for interaction, lots of contact with faculty. We're going to do some field projects. We're going to visit some nonprofit organizations and major non-governmental organizations here in New York City, and give students the best education they can get in this field. The core courses in this program let us focus on the principles of epidemiology, which is really the science of how disease encounters a population and what to do about new and emerging threats. We have core courses on risk behavior and the social context of risk behavior. So we want to help you think about not only what puts individuals at risk for certain diseases, but what puts your neighborhood or your communities at risk, and what can be done to intervene either with individuals or at a community level. You'll have some exposure to what public health professionals are doing in the field. You'll do an internship. There are research opportunities. In fact, you'll do a semester-long research project, some under the guidance of particular faculty members. And we have an honors track, the honors track that you can qualify for, which will match you with a faculty mentor to work with you over the course of a semester. Our public health program also offers opportunities to study abroad. There's plenty of time in your curriculum to go and study in the many sites that NYU offers. But I should tell you that we're also going to be offering some of the public health courses at our site in Ghana that'll give us both field experience on the ground with public health programs trying to address things like malaria and maternal mortality in Ghana, but also give you an opportunity to take courses through the NYU site there. There's opportunities also in this curriculum for you to take a set of electives about a particular public health problem that you might be most interested in, whether that's obesity or environmental health problems or in public policy, or if you want to use that minor to specialize in something outside of the field of public health, there are many opportunities for you to do that. One of the great things that NYU has to offer you in this field is a committed faculty that are interested in teaching, want to work with our undergraduate students, are engaged in the classroom, but are also engaged as public health researchers outside, studying issues as diverse as obesity, as breast cancer, as HIV/AIDS, whether in the United States or in South Africa. Some of us are looking at primary care issues here in the United States, both in really poor cities, but also in places like Brazil and other parts of the developing world. And we're doing some work on issues of reproductive health. So there's a wide range of faculty expertise that you'll get to tap into here. And you'll be doing it in the city of New York, which offers a myriad of opportunities for you to get firsthand understandings of the way in which global public health problems can be seen through the lens of the various neighborhoods in New York. It's a really rich, exciting place to study public health. When people ask me what kind of students I'm looking for to study public health, I guess the first thing I would say is that I'm interested in students who are passionate about what they're doing and engaged in their communities or their neighborhoods, their schools, or are interested in becoming so. I want students who see themselves as global citizens with responsibilities to make the world a better place. So I think if you come to NYU and you're going to study public health, we're going to train you to do those things, to become innovative problem solvers, to think hard and think seriously about the world's problems, and prepare you to go on in a variety of careers. You may choose to go on in law or medicine, social work, business, into the arts, or into the world of nonprofits. But you're going to have an understanding of public health, and I know that that means that you'll be committed to ensuring the nation's public health as we go forward. After all, public health is a broad social enterprise, and we need people across many, many different fields to make this world a better place.